Acute coronary syndrome. Picture it as a traffic system in a bustling city. The arteries are akin to the highways shuttling blood, which we can think of as vehicles to and from the heart, which is the city center. In this bustling city, the essential goods being transported are the oxygen and nutrients required by the heart's working cells. This transport process is what we call perfusion. But what happens if a fallen tree, which is an atherosclerotic plaque in medical terms, causes an obstruction on one of these highways? Traffic builds up, becoming increasingly congested. As a result, fewer vehicles or blood can travel around the obstruction. This leads to a decrease in the delivery of essential goods, oxygen, and nutrients to the city center, or in our case, the heart. In medical terms, this is acute coronary syndrome. It occurs when one or more coronary arteries, the highways of our city, become partially or entirely blocked by atherosclerotic plaques. This blockage can reduce blood flow to the heart muscles, resulting in unstable angina, or even cause a complete occlusion, leading to myocardial infarction. The severity of this traffic obstruction directly impacts the extent of the damage. If the blockage is partially and quickly resolved, the heart, or city center, can recover and return to normal function. But if the obstruction is severe and prolonged, the heart may suffer irreversible damage, a state known as myocardial necrosis. This happens when oxygen and nutrients, the essential goods, can't be delivered in time. As healthcare professionals, we now consider ourselves as the city's emergency services. Our mission is to quickly identify these highway obstructions, swiftly resolve them to minimize heart muscle damage, and ensure the smooth functioning of the heart in our city center. We achieve this through rapid diagnosis, identification of risk factors, and treatments like antiplatelet agents, thrombolytics, nitrates, and surgical clot retrieval. These interventions are aimed at restoring blood flow and delivering essential oxygen and nutrients to the affected heart muscles. So, remember, our goal is to keep the city running smoothly, and every second counts.